So the PAF project was to assist vulnerable young people and their families during the transition to parenthood. And in this project, it included both mothers and fathers, and the age range was 15 to 24. And the young people really have challenges in this time period, and the program was really committed to meeting those educational, social services, and healthcare needs of the young people and their children during the pregnancy, as well as in the postnatal part of the period.
The first year of this grant was very interesting in that the three major partners at the state level really had never worked together, but we worked it out, and each of us bringing our unique skills and talents to this, not only grant, but to these young people who were trying really hard to be great parents. And together we have made an impact on so many young families and their communities, being able to help them integrate, find resources, and be the good parents that they want to be.
One of the things I think that has been really good about this partnership as well is that while in each of our day-to-day work, we may be looking at the individual as our client. And I think through the PAF grant, we've been able to look not just at individuals, but be able to say, let's look at this family and to see them as a whole rather than the individual members of a family.
I would say the greatest impact, of course, is going to be the young fathers and mothers who the light bulb went off, who really got it, really understood what their responsibilities were, and began to just move forward, began to take those steps, starting off with baby steps, but really going to the next level and beginning to think career and future oriented, and getting on that path towards being a responsible adult, being a responsible mother and a responsible father. That's going to be I think the greatest impact. But that's 1A. Then 1B would be the network we were able to form of these different community organizations, human service organizations, coming together to provide a safety net.
One of the things that we found is that the trusting relationship between the case managers and these young women is what makes this program successful. And one of the reasons it is they really empower these young moms to be the expert on their own child, learn what is developmentally appropriate for the children, be able to consider different parenting styles or at different ways that they can bond with their children, because they're so busy and sometimes that doesn't happen naturally.
This program laid a foundation for our future work. Our work now with young men prior to them becoming fathers, helping them make wise and responsible decisions, giving them a reality check as it pertains to becoming a father too soon, is an extension on this work that we began with the PAF Fund. If we can help young men, young males, either before their fathers or with having that first child, to begin to think, become more future-oriented, more career-oriented, begin to think about their decision-making process. That is one of the great things that's come out of PAF, is just the need to continue to work with young males and even work with younger males.
And I hope that the lasting effect would be that through the providers in this area and across the state, that young parents are respected and allowed to be the experts on their children with the information and access that we give them and resources that we give them, and that they would be respected and finish their education and be able to move out of that cycle of poverty that they might have otherwise been trapped in.